this is Selma Schimmel for the Group Room at the ESMO 2012 Congress happening now in Vienna. And I'm happy to introduce you to Dr. Maria De Santis, who is the director of the genitourinary program at the Kaiser Franz Joseph Hospital here in Vienna and chair of the ESMO GU Non-Prostate Task Force. Welcome to the Group Room program.
Well, thank you for the kind invitation. I'm happy to be here.
What about any findings for other GU cancers, testicular cancer?
Testicular cancer has become a highly curative disease with the induction of cisplatin combination chemotherapy and with the introduction of the BEP regimen. And the high cure rate is really difficult to beat with any other regimen. This has been shown in really a lot of randomized phase 3 trials. Still, some patients relapse after 3 or 4 courses of BEP for metastatic disease. And for these patients, we do not have a clear standard. It is not clear if high-dose chemotherapy or standard dose cisplatin-containing chemotherapy like the PEI or TIP regimen is better. So this is a really important question in treating testicular cancer. And for this, we would need a big randomized phase 3 trial in a very rare tumor and in a very rare tumor entity and in few patients who relapse. So there is a global effort to do this sort of trial right now. At this year's ESMO meeting, one standard dose regimen was presented by the University of Southern California. David Quinn presented a paper on a triplet regimen, which is not cisplatin containing but oxaliplatin containing, which is a later generation platinum. And this triplet contains of oxaliplatin, of gemcitabine, and of paclitaxel. And this triplet was studied with the intention of a dose intensification, a dose density of oxaliplatin, and this was given at a 2-week basis. So in the study, 30 patients were included, and these patients were a sort of mixed patient population. And notably, 11 patients in this trial, they did not have coverage for high-dose chemotherapy, for example. And so they went on this trial. They did not have secured coverage of financially. And the other patients were refractory to cisplatin or after high-dose chemotherapy. So in these 30 patients, David Quinn and colleagues showed that the regimen was feasible on the one hand, that toxicity was manageable, and that there was a 30% response rate, which is quite high and which makes this regimen really interesting. And in addition of these 30 patients, 5 patients were made operable, and they had a complete resection of their tumors. And this is very important in this patient population, to have chemotherapy and then complete resection of their tumors. And these 5 patients have the chance of really long-term survival in a state after high-dose chemotherapy, so a 3rd line or even a later line chemotherapy, or in patients in a sort of 2nd line setting. So this is really interesting data, and it is confirming other data that was presented before or even published in the Annals of Oncology by the German group. They also used a triplet regimen with GOP at a 3-week basis. And I think nowadays, and David Quinn and colleagues confirmed the data of the GOP regimen, nowadays it is the most interesting and most promising standard dose chemotherapy regimen in this patient population that is refractory to cisplatin or progressing after high-dose chemotherapy.
Thank you, Dr. Maria De Santis, Director of the Genitourinary Program at the Kaiser Franz Joseph Hospital here in Vienna, and Chair of the ESMO GU Non-Prostate Task Force.
Thank you for the kind invitation.